So, namaste and welcome to this podcast, Dr. Vikash Goyal ji. And thank you so much for taking out time to address a lot of concerns which people have regarding heart health. And today we'll be covering certain questions, certain notions which people have. बहुत लोगों को कुछ misconceptions हैं heart health को लेकर. तो आज हम उन questions पे discuss करेंगे and would require your assistance and guidance over it. So thank you so much for joining. Thank you. So, sir, सबसे पहले first question a lot of people have: how hypertension, stress, and anxiety is related to heart health?
नमस्ते फ्रेंड्स। मैं डॉक्टर विकास गोयल हूँ। मैं एक सीनियर कार्डियोलॉजिस्ट हूँ जो इंटरवेंशंस भी करते हैं और प्रिवेंशन भी करते हैं गुड़गांव में। सो बेसिकली हमारा जो हमने आमतौर पे देखा है कि स्ट्रेस हमारी लाइफ में बहुत ज़्यादा है। जो छोटे बच्चे होते हैं उनको स्कूल का स्ट्रेस है, जो थोड़े बड़े हो गए उनको जॉब का स्ट्रेस है, किसी के शादी के बाद का। तो दे आर लॉट्स ऑफ स्ट्रेस। स्ट्रेस से डेफिनेटली हमें थोड़ा नेगेटिव इम्पैक्ट पड़ता है ओवरऑल हेल्थ पे, एज वेल एज हमारे हार्ट की कंडीशन में। हमारा जो हाइपरटेंशन है, कुछ लोगों का तो जेनेटिक होता है, कुछ लोगों का स्ट्रेस इंड्यूस होता है। मतलब रात में नींद नहीं आती या चिंता ज्यादा करते हैं, तो उस वजह से उनको बीपी की समस्या, हाइपरटेंशन दे गेट, एंड समटाइम्स द पाल्पिटेशन व्हिच दे हैव। So whenever a patient take stress, there is a negative hormones called catecholamines are secreted, which increases our heart beating, which increases our pressure, which increases our palpitation and all those symptoms. And all these can lead to hypertension, and hypertension can further lead to major adverse heart diseases, and which can be harmful.
Okay. थैंक यू सो मच। एज यू सेड सर, इंडिया के अंदर स्ट्रेस एंजाइटी बहुत ज़्यादा लोगों में देखी जा रही है एंड बीइंग एन एंजाइटी ट्रांसफॉर्मेशन कोच आई एम एवरी डे सीइंग लॉट ऑफ वर्किंग प्रोफेशनल्स, बहुत ज़्यादा उनको एंजाइटी है, वर्क प्रेशर बहुत ज़्यादा है। तो काफ़ी लोग की ये कंसर्न है कि उनकी स्लीप चैलेंजेस बहुत हैं, दे आर नॉट एबल टू स्लीप एट नाइट। सो इज इम्प्रॉपर स्लीप या फिर स्लीपिंग फॉर 3 to 4 hours विच इज इम्प्रॉपर एंड नॉट गेटिंग अ साउंड स्लीप इम्पैक्ट्स हार्ट हेल्थ, एंड कैसे कॉन्सिक्वेंसेज हैं स्लीप के हार्ट हेल्थ को लेके?
Yes, sleep is a very important part of our body. देखिए, जब when we sleep, our heart rate goes down. Like if someone is having heart rate of 60 to 70, it will go to 50, or some 100, it will go to 80. So when whole body is taking rest, heart is also take some amount of rest by decreasing its beating, taking some relaxation. So sleep plays an important role. And that quality of sleep and duration of sleep is also important. But quality of sleep we can't measure. So we measure it by the duration of sleep. If we get sound sleep for 6 to 8 hours, we can do our whole day activities in a very good manner. And there is one disease which is related with sleep, that is called as obstructive sleep apnea. In that, we have snoring and our tongues and jaw falls back, and there is some blockage. And during that blockage, we get apnea, in which we are not able to take proper respirations. So if someone is having this disease, there is a more prone those patients are more prone to develop atrial fibrillation, that is the abnormal beating of the heart. They are more prone to develop hypertension. They are more prone to develop coronary artery disease. This disease generally find with the obesity. So by this disease, we can understand that sleep plays an important role.
ओके, सो बेसिकली स्लीप को हमें बहुत ज़्यादा फोकस करना होगा कि हमारी स्लीप हमेशा डीप हो, रिलैक्स्ड हो, और हम कुछ ऐसी प्रैक्टिसेस करें जिससे हमारी स्लीप बहुत डीप हो, जैसे मेडिटेशन प्रैक्टिसेस होती हैं या फिर कामिंग डाउन प्राणायाम्स होते हैं, जिससे हमारी हार्ट बीट रिलैक्स हो जाए और हम स्लीप का जो फायदा है वो ले सके, विच इज बेसिकली रिजुविनेटिंग, रिलैक्सिंग आवर एंटायर सिस्टम।
Yes.
थैंक यू सो मच सर फॉर शेयरिंग दीज इनसाइट्स। एक और क्वेश्चन जो आजकल आमतौर पर काफ़ी लोग फेस करते हैं इज डाइट। सो बिकॉज ऑफ, as you can see, a lot of fast food delivery apps, because everything has become so convenient, people do not want to invest time in selecting a proper diet, but also there is emotional eating. When people are going through stress or anxiety, they want to eat some junk food. So how diet and heart health are linked, and the improper diet, अगर कोई लेता है काफी ज्यादा जंक फूड या फिर ऐसी सारी चीजें, पैकेज फूड्स, हाउ डज इट इम्पैक्ट आवर हार्ट हेल्थ एंड व्हाट आर द कॉन्सिक्वेंसेस?
Diet definitely plays a very important role, because in the heart health, we always focus on the prevention. If we have a good diet, good exercise, and good calming ways to calm ourselves. So like diet, especially I will give you an example. Like few days back, I was going through the Instagram and I found there is some link mentioning that in ice cream there is a palm oil, which I was never knowing before that.
Yeah.
And when I went through the that details of the ice cream, definitely there was mention about the palm oil.
Hmm.
So palm oil is one of the harmful thing which we can have.
Hmm.
Another thing which you have mentioned as well is the apps. So the apps we can order food from the outside. So which nowadays people are cooking less and they are ordering more from the outside because
Yes.
of the many reasons, because of the more involvement in the parties, because of the lack of the time,
Hmm.
because of the they don't have time to cook, all
Hmm.
those things
Hmm.
which lead them easy availability of the outside food.
Hmm.
And the quality of food which we get is also not as good as we have before, like our grandfather will have, because at that time there was more of organic farming. Now there is more of chemical farming, and because of which also we get not a quality food. All this impact badly in our heart health. And especially if you go outside, I will give one more example. Like if you have ever went to a samosa shop, so
Yes.
they take a oil in the morning and in the same oil they cook till the night. So in the
Yes.
morning it's oil and the evening it becomes tada.
Hmm.
So
Yes.
it's again and again, it's burned multiple times and it's very harmful for our health.
Okay. So in diet, anything specific which is impacting heart health badly? Any particular thing which you would like to mention?
Yes, definitely. Outside food, taking lots of fast food like burger and these pizzas and all those things,
Hmm.
and easy like taking lots of butter, oil, all those things. And I have seen more of obesity trends nowadays as compared to before. And in diabetic patients, when the patient eat lots of sugars, these
Hmm.
all also harmful.
Right. Processed foods, biscuits. I was also doing my research of biscuits and chips, and all of these have palm oils, which is
Yes.
trans fats, which is again a very harmful factor for heart health. Thank you so much for highlighting the importance of diet in our heart health. I would like to ask you something regarding many people hold on to past trauma, past anger. Life में पीछे बहुत सारी चीजें हुई हैं when they were growing up. They have experienced some loss, some anger, which they are still holding on to. They are not able to let go. So, does these emotions like trauma, anger, frustration, deep sadness, does that impact the quality of our heart?
Yes, past trauma, or if they hold on very bad situations and all in the life, if they think too much, that will affect our heart. Nowadays, I have seen a special kind of a disease called cardiophobia. It's a
Yes.
kind of obsessive compulsive disorder in which they think that they are suffering from a heart disease. Even we prove it, even with the angiography, then also they don't believe us. And after 2 weeks, they will again come to us.
Yes.
And I have observed these kind of situations are more in the persons who is more tense, who are more stressed, and who have lots of responsibilities, and they do not find any cope-up mechanism. Like
Mm,
they're not able to calm down themselves. In
mm,
those patients, I have seen this cardiophobia. And definitely when you have take too much of stress and too much of holding the past experience, bad experience, especially you will have a heart feelings like palpitations. You may be having anxieties. You may be having lack of sleep, and
mm.
all these symptoms, all these things indirectly affect our heart health. So
Okay.
definitely these have bad effects.
When people feel angry, their heartbeat is increasing very much. They are too much tense. They are over sweating. I would like to understand, what does palpitation mean? What happens in our heart when people say that we are feeling palpitation, that is irregular heartbeat is happening? So how the things are moving inside our heart? What is happening there in the chest area when a person is in palpitations?
Yeah. When person is in a palpitation, it means that he is able to feel his or her own beat. Like we are sitting, we are not feeling our heartbeat. When
Yes.
we start feeling our own heartbeat, it's called as palpitation. That is a symptom. It can be related to many diseases like valvular pathology. It can be abnormal beating of the heart, which is maybe related to the stress. It can be in a harmful way or it's a normal physiological response.
Correct.
Whenever we have a palpitations, the heart has to work more either in a forceful way or in the rhythm way, means more times or more forceful. So that will make our heart to exert, like exhaust. It can exhaust, it can have a more effort it has to be taken.
Hmm.
So
Okay.
that overall can lead to a bad effect on our heart health.
Okay. So if I'm understanding it correctly, if I give you an example that when we driving a car on mountains, so the engine has to burn more fuel because it's
Yes,
elevated. And when we are
yes,
on a plain road, a plain highway, then the engine works smoothly in fifth gear, the car is speeding up. So the similar way, when people are going through stress, anxiety, basically their survival instincts are coming up now. They are in the survival
yes,
mode. And that is how heart is consuming more energy, pumping more blood, and that's why it is beating fast. Am I correct, sir?
Yes.
Okay.
Yes, sir. Yes, sir.
Okay. Nowadays, as you mentioned, cardiophobia, there is one more reason because all around us, we are observing many people are getting heart attacks at a young age. We are seeing this pattern now, and people in 30s, 40s. This was not the case earlier. So what do you think are prominent reasons कि ये आजकल यंग एज में हार्ट अटैक्स बढ़ रहे हैं एंड इसकी वजह से काफी फियर लोगों के अंदर आया है मेजरली आफ्टर द कोविड टाइम्स दिस वी हैव सीन दिस इज एज अ ट्रेंड सो वुड लाइक टू नो योर इनसाइट्स ऑन दिस सर.
Yeah, this like for the in my DM time, I have done thesis, especially in the young people who are getting heart attacks. So what I found most common reason is the smoking. So
Okay.
recreational activities, even vaping, smoking, electrical cigarettes, and all those things which are coming,
Hmm.
which are causing harmful effects on our body. So smoking is one of the leading cause, which I
Okay.
can understand. Another reason which I found in my few of my patients, it's lack of activity,
Hmm.
especially in the IT era, when many of the people are working through the computer or the laptop, they sit still for like 5 hours, 6 hours or something. So they don't move around. So it's in a study, it has been found that if person is sitting continuously for 2 hours, it's equivalent to having one cigarette.
Oh,
So it's
okay.
so much of risky.
Hmm.
And in the same town, same in the same thing which I also observed, I got one patient who is having IT works and he sits for 8 hours. Even his lunch, breakfast, everything comes on his table. So
Hmm.
he is eating and working. So that fat will deposit it in the body. So
Hmm.
lack of exercise is one of the factor. Then comes the dietary habits. Now lack of exercise is there, but our dietary habits are same. We eat lots of butter, ghee, especially in few religion. It's believed that ghee and butter and all are very healthy, and
Hmm.
it's very much required for the building the body and brain and all those things,
Hmm.
even in the adult stage,
Hmm.
and which is a like a bad concept
Hmm.
because it can deposit in our coronary arteries and can lead to heart attack. So
Hmm.
these are the factors like lack of the activity,
Hmm.
dietary habits, and recreational activities
Hmm.
which are causing heart attacks in the young age. And in the last, whenever a person is having family history,
Hmm.
like a
Hmm.
father, mother is having a family history, then he is more prone to develop a heart disease at any age. And with combining these factors, the age which would have been 40 years, it has come down to 20 years. So now I
Hmm.
have approximately 5 to 10 patients who
Hmm.
are age of 18 to 20 years and they are hypertensive and diabetic. So
Oh,
you can
okay.
understand such a, and they are all obese,
Hmm.
very tall and very big size.
Hmm. Okay. So in this case, particularly people who are living in metro cities, they are also a party culture has evolved. Where on weekends, people Monday to Friday they are working, they're so much in stress, and on Saturday Sunday they just want to enjoy so that they can recoup with all the 5 days of stress. And what is happening? They are going, they're consuming alcohol, they're consuming all the trans fats like pizzas, burgers, junk food. They are having it, and they are, and also alcohol impacts sleep as well. So all of this in combination is somehow impacting heart health badly, right, sir? So,
Yes, yes,
so,
definitely.
so in this case, particularly, what are the three important factors which a person should keep in mind if he's living in a metro and if he's a working professional? What simple step he can take to prevent it?
It's a very good question. What are the simple steps he can take? So, first, he should walk as much as possible. Like if he's on the call, which can be done through the telephone without video call, he can do that by walking. One
Yes.
thing, or can do 10 to 20 minutes of brisk walk to keep the heart healthy. Second thing, avoid outside food as much as possible.
Yes.
And third, avoid these cigarettes, smoking, and these recreational activities. If these three
Okay.
steps he take, I think 50% reduction will be there in the
Hmm.
MI or the heart attack in the young individual.
Okay. That's a great insight. Also, in anxiety and fear, person goes in fight or flight mode, which is a survival instinct. And many people experience a lot of acid reflux due to that because fear attacks gut. And that acid reflux somehow creates congestion near the chest area. So sometimes people get this fear that am I getting a heart attack or something is happening. Now, I want to also understand the relationship between gut and heart health because gut is impacted by a lot of stress and anxiety factors. Diet, we have already discussed. When a person is thinking, overthinking too much, his gut is upset. Some IBS is happening, acid reflux is happening. So, is there any relation between gut health and heart health also, sir?
Gut health and heart health, there is no direct relationship, but there are few studies which are going on. regarding the relation with the gut health and the heart health.
Okay.
Definitive results are not there, but still we can say if someone is having heart issues, it can be associated with gut issues, like especially if the low ejection fraction is there, heart pumping is low, there can be congestive gastropathy. In that, the patient can have a constipation or something like that.
Okay.
So that can be the possible. But
Hmm.
diet correlation between the gut and the heart health is not there, and well, it has not been proven. And
Okay.
you have also mentioned about the flight and fear thing.
Yes.
Whenever there is a flight and fear, there is a hormone called cortisol is secreted, which
Yes.
is increases our blood pressure, makes our arteries more stiff, and it will make our situation so that we can run from this that situation. Sometime the patient will end up in a panic situation at that time because heart
Hmm.
start beating. He may feel sweating or something.
Hmm.
He may feel that he is about to die or may develop a heart attack like in a
Yes.
short span of time. And with that fear, he may visit to emergency.
Hmm.
So these things can happen.
Hmm.
And with the continuously secretion of the cortisol hormones or
Hmm.
with continuously fear and these things, the repeatedly stress on the heart can lead to
Hmm.
the stiffness of the coronary arteries or the
Hmm.
aortas and the big vessels, which
Hmm.
can lead to the hypertension and coronary artery disease.
So, Okay. sir, right now, many youngsters want to understand that if there are any tests which they can go as a preventive measure to understand the condition and quality of their heart, because of a lot of youngsters getting heart attacks, so nobody knows what is going on inside. Are there any tests which you would like to highlight which can really help a person understand? Of course, after the test, they can consult you and you can guide better. But what are certain tests which a person can do to examine his heart condition, his heart health?
Yes, they are very simple tests which we can do. One, first of all, we should consult any physician or cardiologist to evaluate us for any risk factors like smoking, sedentary habits, like family history, all those things.
Okay.
Number two is the checking your blood pressure.
Okay.
Number three is checking your sugar level.
Okay.
Number four is checking your cholesterol level. And
Mhm.
then number five comes the three test panel, which includes ECG, echo, and stress test, which can be a TMT test, stress echo test, any of the two. So
Okay.
by doing these five tests means physician consultation, checking your blood pressure, cholesterol,
Sugar.
sugar, and the three tests which are ECG, echo, and TMT, you can check whether you are healthy by the heart wise or not. And it should be done not very frequently. Once in a year is fine.
Hmm.
If your age is 30 and more than that, once in a year is fine. But if you have a strong family history, you should start doing this from the age of 20 years.
Hmm. Okay. Okay. All right. So, sir, some people also go for CT NGO. So, is that a next step after these tests to check their heart health?
Yeah, CT angio is now quite popular nowadays
Yes.
because of the social media, and
Yes.
it's definitely a test which can tell you 100% about the blockages
Okay.
which a person is having or not having. But generally, as a cardiologist, we do not recommend CT angiography in all the patients. Reason being the dye which we use. Number two, the radiation which we need to be exposed,
Mm,
and
mm,
third is the cost effect. It is
okay.
being done in from 8,000 to 20,000 in different cities and different centers. And
Hmm.
TMT test is good enough to diagnose if you have any significant blockages. So
Okay.
unnecessary doing CT angiography is not recommended. But if a cardiologist or some senior physician, some senior doctor has advised, then you should go for CT coronary angiography.
Okay. So thank you so much, sir, for the insights. I'm coming towards the last questions and would like to know the importance of I say in Rishikesh, which is also known as Yoga Nagari, yoga capital of the world. So what do you feel the importance of yoga, mindfulness activities like pranayam, doing asanas every day, and all of these mindfulness practices have a direct impact on our heart quality and heart health?
Yes, yoga is a wonderful practice and it has been practiced from the years we don't know
Yes.
as per the literature. And I feel even when I am in stress, I sit down calmly at a place and just leave my body relax and just stop thinking. I feel very calm and relaxed. So
Yes.
when I can feel calm and relaxed, my heart
Mm,
may also be feeling the same sensation.
yes.
If you understand the stress level, whenever you are stressed, you feel some kind of atypical symptoms or some kind of uh, tension near your heart area.
Yes.
And that same tension goes when you involve yourself in calmful activities.
Yes.
Even the World Health Federation also believes that you should involve in joyful activities.
Yes.
What does joyful activities does? It will relax us. So
Hmm.
in the same way, yoga will do, and yoga will have also a decrease our heart beating so that
Hmm.
heart can relax, like same thing which we are doing when we are sleeping.
Hmm.
And what it does, it's our stretching of the our whole body. So in the
Hmm.
same time, it will help our heart to
Hmm.
supply adequate amount of the blood to get the pushed in the all over body, and
Hmm.
to be get good amount of nutrition and the refreshment of the whole body.
Okay.
So I think yoga should be practiced by all the people for at least some 10-20 minutes or something to calm
Hmm.
down themselves in such a stressful situation, especially in the metro cities.
Yes, sir. So we have a community where every morning we do these practices, and also at night we have created a night care routine for the community where we have some rituals that 1 hour before the sleep, no usage of phone should be there, no screen time should be there. Because right now, the major addiction which is coming up is the screen time, is addiction towards phone. And when people are just scrolling, there is a new quote which has come: scrolling is the new smoking. So people are just scrolling, and 2 hours pass by and they just do not even realize it because that gives them a hormone rush. So we are following such practices within our community, which is really helping them understand the importance of simple living, and which is actually somehow also impacting their entire body and mind health. So, sir, thank you so much for joining me in the podcast. I'll be sharing your details with my community. Whoever wants to consult you, whoever wants to take the test, they can directly connect with you, and you can guide them further. But thank you so much for taking out time. And it was a blessing to have you, sir. Thank you so much.
Thank you. Thank you very much.